Now, if you've got blood that is squirting,
You're bleeding like a stuck pig. Now, with these sucking chest wounds, what is happening? I mean,
okay, and you don't need any more bleeding than you've already got. If you're out in the wood, everything hurts. Everything hurts. Suck it up. Deal with it. Get out of the woods. Get to a hospital. Get to a doctor. You need to get something and stop the bleeding from the stump where it used to be.
is it safe to say that if you give in to the panic, you're basically going to die?
Yeah, you're going to bleed to death.
All right, y'all, welcome back to the channel, Old Southern Pine. Here we've got a guest on the channel, and fittingly so, that's my very own mama. A quick bit of backstory about my mama. She was an emergency room nurse in downtown Atlanta, Georgia for a lot of years, back when Atlanta was the murder capital of the United States. She was also on loan to the United States Army to teach field medics how to give, what do we call it?
Autotransfusion. This was taking blood, somebody that was shot in the chest and bleeding, and take that blood, give it back to them.
So basically, you are in the presence of a lady that makes Wonder Woman look a little more than a Girl Scout going door to door selling cookies. Mama, welcome to the channel.
Thank you, son. I'm glad to be here.
So, Mama, today we are going to be going through, called various different terms, IFAKs, which is an individual first aid kit, a field trauma kit, ouch pouch, all of these different kinds of things. And as we've talked a little bit about in the past, apparently I've been doing this very wrong for years. So we're going to go through and have you kind of teach us what to do better.
I've tried to teach him for a long time. I'll work at it again, okay?
If it hasn't taken by this point, it's probably not going to.
This is in no means a registered first aid course, or this is just some simple things that it's kind of important if you're out in the field and you run across somebody that's hurt or you hurt yourself, some few things that can do that can help speed things along.
And by speed things along, you mean get yourself out of the woods, not speed yourself onto the afterlife, hopefully?
Yeah.
So,
you know, all things stop bleeding eventually. And, you know, it's not for the squeamish, but if you're out there alone and you run across somebody, there are some things that you need to know and that you need to do. What's the most important thing about being out in the woods alone and there's an emergency of some sort?
to remember that everything stops bleeding eventually?
You know, you're close, fairly close. But the most important thing is that somebody knows where you are at all times. They need to know where you're camping. They need to know if you're going off walking. They need to know where you are at any given time.
Fiona usually knows where I'm at.
You know, that's fine, but Fiona's not really good with bandaging up wounds.
I mean, she is soft and weight. You can't just kind of pick her up and, you know.
No, there's an ABC. We're big on acronyms in the medical world. And airway. You know, you got to make sure that they're breathing. That's the first thing. Make sure that they're breathing. Are they choking? Simple. Heimlich maneuver. Thing about Heimlich that nobody tells you is that after you get the whatever's obstructing, they puke.
I didn't go into the woods to have somebody puke on me.
Well, you know, you've had worse on you. Okay, the next thing is, are they breathing? You know, if you come across, but they're not breathing or they're not breathing well, then you need to assess what's going on there, why they're not breathing. Is there something that you can do, like starting CPR? You can check to see if they've got a pulse. Don't go for the wrist, you go for the carotid right in there. Just go for it. If you don't feel it, then you've got a big problem. Start CPR. And CPR has changed over the years. Now it's pretty much compressions, good hand placement, good pressure to make a compression. The thing about that is it breaks bones, it breaks ribs. And I've seen grown residents finishing medical school into their residency, start CPR, break a rib, and pass out. Them, not the patient. Your nerves are shot. You're nervous, you're scared. You know, this is a big deal. You start pushing on somebody's chest and you feel the bones break underneath your hand, but not nearly as big as the problem is that your heart's not beating. And the thing about breaking ribs, it does make the compressions easier.
I can imagine that it would.
If you're going to be in the woods, you probably do need to take a Red Cross CPR course. Everybody needs to know these type things. I just kind of want to touch on a few other things. The most common things that you're going to come upon or that's going to happen to you are burns. You've burned your hand, you've burned your leg.
You caught your sleeping bag on fire.
You caught your sleeping bag on fire. If you've got a burn, you want to cool it down. You can use a little saline on that. Actually, you can use anything. You can use any water that you've got.
You know, all winter long, living in Minnesota where it's in the negatives and there's quite a bit of snow, that's a pretty easy time when I've got a stove or a fire, basically a live fire in the tent with me. Sparks come out of that all the time. It can easily catch the tent on fire if it's not a well-produced, flame-resistant tent. But you also have nylon jackets on. You have a nylon sleeping bag a lot of times that you're in. You know, you're talking about trying to get it cooled down. Should I use like snow or something like that?
If you don't have anything else, use that snow, but don't pack something in snow, completely pack it. You might want to just put a little snow on it and cool it down. Another thing you said was nylon jackets. Okay, nylon jackets will melt into your skin when you've got that. Do not, under any circumstances, pull anything that's attached to the skin off. Do not pull it off. Certainly put a little ice on it and a little snow on it to keep it cooled down, but don't leave the snow on there. Just cool it down for a second, brush it off. And then take a clean, if you have a sterile 4x4 or whatever size gauze pad, you can put that on there and then wrap it up. But you don't want to pack it nice and leave it on there for any length of time. And you need to go someplace where you can get that taken care of.
So don't just finish out my camping trip.
Don't finish out your camping trip, and don't pick off anything that's burned. And people will do that. They'll see that and they'll rip it off, and it makes a really big mess.
So try to get the clothing off maybe around it that's not burned to
your
skin.
Yeah, and that's fine. Yeah, and that's fine. And you can use that clothing that you've cut off to make, to tie it on if you can't find your gauze pads and stuff like that. It doesn't have to be completely sterile. It'd be really nice if you had something sterile, but you're out in the woods, you may not, so.
All right, guys, so we will break into what we've got here. So this goes by a lot of different terms. IFAK, which is an individual first aid kit, an ouch pouch, trauma kit, over-the-counter store-bought first aid kits. Yeah, first aid kits stuff are virtually useless. They may have a couple of items in there that you really want, but having just an over-the-counter first aid kit, it doesn't do anything. What you want to do is basically build it out for what each individual setting that you're going to be in. You want to be able to have something that is relatively lightweight, packable. You don't want to add a bunch of weight to it. You're not trying to take the entire hospital with you. Right here, I've just got a pouch that's got the MOLLE straps on the back.
Okay, this is his kit, and actually, in all fairness, I have added some things to it.
Quite a bit.
Like scissors, important. Cut off what you need to cut off. Not limbs, not tissue, not skin of any kind. I'm talking about cutting off clothing around certain areas, clothing that you might want to cut off to use to wrap something in or whatever if you don't have any sterile stuff with you. Gauze pads, wrap it, tape it. Do not wrap anything so tight that it's cutting off the circulation below the injury, okay? Loose as a goose is good. Ace bandage. Ace bandage is great. You fall, you break your ankle, you break your leg, grab a couple of ski poles. There's a lot of hiking sticks, sticks off the ground. Put a couple on it to kind of keep it straight. Wrap it in an ace bandage. Get the heck to a doctor. Bleeding, this is called blood stopping spray, and what it does is just coagulate the blood. It's not going to do, we'll go to cuts and stuff in a minute. It will do some good if it's a oozy type blood. It'll do some good to stop that. But most important is probably taking your gauze pad, put pressure on it, hold it for at least 5 minutes. Now, if you've got blood that is squirting,
If you're bleeding like a stuck pig,
or you're bleeding like a stuck pig, which is rude.
all depends on the pig, I guess.
If you're bleeding, if it is pulsating, if it is bleeding a lot, then you want to hold pressure on it for a few minutes, check and see if it's still pulsing, and it's large and losing a lot of blood. And a lot of blood that's lost quickly is a bad problem when you're out. So
you only got so much of that stuff in you. Actually.
Everything stops bleeding eventually, but you want it to stop on your own terms. You can put a tourniquet on above the wound. Be very careful when you're putting on a tourniquet that it really is pulsating blood and it's not going to stop with pressure. Go ahead and put your bandage on. Go ahead and wrap it up. Go ahead and put a tourniquet. What can I use? You can use a belt. You can use a piece of cut off material that you've tied up and taken a stick and twisted till it stops the bleeding. If you've put on a tourniquet, be sure and mark the time that you put the tourniquet on. Whether you use a pen that you've got in your first aid kit or whether you write it in blood, the time it needs to be on. Tourniquets need to be loosened every hour so that you don't ruin the rest of the circulation to whatever body parts you've got tightened off. Yeah, so be sure and remember that.
I know one of the things that I've had some near case experiences with, and I know other people that have had it happen to them. But it's you're walking through the woods. It's easy to just trip over something. I mean, I've got a big pack with me a lot of times, and you fall. There's been times where there's been a stick that easily could have gone into my chest. What am I supposed to do at that point?
Do not, under any circumstance, pull it out.
That's going to take some pretty serious willpower, because isn't human nature just to automatically just freak out and get it out of you?
Absolutely, but you just got to keep screaming at them. You come upon somebody that's got a stick stuck in their eye, and that can happen when you fall. Do not pull it out. Do not pull it out. The best thing you can do if you've got a cup with you, or you've got something you can put over the eye to keep and tape it so that they can't reach up there and pull it out. Same thing with the chest, if you can put anything over it.
So basically, you could take a shirt or
you can take a shirt and
gauze wad and
put it around the edge of it and push it down. If they do happen to pull it out, okay, these are little tegaderm dressings. It could make a sucking chest wound, and it sounds like a sucking chest wound. It's a sound that once you hear it, you'll never forget it.
I already want to forget what that sounds
Yeah,
like.
well, you don't want to ever see it either. But you can take, if you have a few of these here, these are that stick on. You know what tegaderm is? It's just a clear bandage that you stick on.
Just something to create
Just
a seal.
something to create a seal that it'll keep on.
Now, with these sucking chest wounds, what is happening? I mean, the fact that there's something called a sucking chest wound is nauseating enough.
It's pretty much punctured into the lung itself, and the lung can't obviously expand and contract because it's got this big hole in it.
And a lot of times, I mean, I'm never at a place that's got Wi-Fi. I'm rarely ever somewhere that has a cell phone service. Now, Lovely Bride always knows a GPS location of where the camp is and when I will be checking in, that kind of thing. But again, if there's some kind of an emergency, your cell phone's not going to do you any good. There are products out there like a Garmin InReach, Spot is another one that will, they use satellite GPS to be able to send out emergency signals, or, well, I think with a Garmin InReach, I think you can actually send somebody a text like that. And they're quite a bit expensive, but at the same time, they're not so expensive whenever you're sitting out there with a sucking chest wound.
Okay, so you've got a few things in here that you need. One of your most valuable, tweezers. Tweezers are wonderful. They are wonderful. What happens when you're out there? Splinters. You can scratch it up, pull it out with that.
Good for getting ticks off of you and splinters out of you. And
right, tweezers are good.
as minor as it sounds, splinters are, they're not really an injury, but they are definitely a nuisance. And any injury that you sustain or nuisance in the woods is always amplified. So being able to get that out of there, this past weekend alone, Fiona and I both ended up getting quite a few thorns stuck into us. And having tweezers like that was really good in being able to get those out of us.
He's got super glue here. If you've got a minor wound and you can clean it with a little saline, if you don't have any salt water, you can make it. maybe about a teaspoon of salt and about a cup of water and stir it up and pour it on there.
Or you can pee on it.
Urine is a sterile fluid, but most people don't want you to pee on them. It's just not something people want you to do, so go with the saline if you can. You can blot the saline off of it, dry it up, tape on either side, and put a little strip of super glue down. Really minor cuts.
So how minor are we talking? Like, I mean, basically, can you do it in the form of stitches or something like that? If you're not going to, I mean, most people probably don't want to sit there and sew themselves up in the woods. Can you use that to kind of at least create a superficial stitch until you can get out of the woods?
You can do that, yeah, and it's pretty effective. I think we've talked about sprains and strains and possible broken bones before. There's an acronym because, medical people like to use acronyms. The acronym for this one is RICE, R-I-C-E, rest, ice, compression, elevation. You don't want to put the ice right on the skin. You want to put it over top of the ace bandage or whatever you've wrapped it in for compression to kind of type it. And I see that in here you have Advil. Don't give them Advil, aspirin, because, throw it away, because it's a blood thinner, okay? And you don't need any more bleeding than you've already got. If you're out in the wood, everything hurts. Everything hurts. Suck it up. Deal with it. Get out of the woods. Get to a hospital. Get to a doctor.
You just threw my stuff. This was the exact same advice that she gave me every time I scraped my knee as a kid.
And he sucked it up, and he dealt with it, and he went back out to play. Mother of the Year, right here. All right, I want to talk just a little bit about head injuries, because head injuries are awful. You just need to get help, or you need to get out then. Come across somebody, they're dizzy, they're double vision, they're confused. There's nothing you can do. There's no first aid for that. They just need to be somewhere where they can get help. You got any questions, big boy?
I don't know. I can't get past sucking chest wound.
Hopefully you'll never come across anything that is that serious or that. I mean, hopefully what you're going to run across is somebody that's fallen, got a sprained ankle, it's fallen on their, sprained their wrist, maybe broken a finger. Oh, speaking of, if you cut your finger off, first of all, you need to pick it up off the ground. You need to get something and stop the bleeding from the stump where it used to be. You need to, and hopefully you've got some kind of container that you can fill with water. Even if it's a little plastic bag, that would work. Preferably if you've got a little saline, that's even better. If not, throw a little salt in there with the water, put the finger in there, close it up, get to a hospital, put something on the stump to stop the bleeding. Try to refrain from putting ice on it, okay, or filling it full of snow. If it's just all you have is snow and don't have any water, then melt it down a little bit before you put it in there, or rub it so that you just don't want to freeze it. You don't want to freeze the digit that you're, talking about amputations, a finger or toe. It's scary. I mean, that in itself is enough to just bandage it up as quick as you can. If you cut off an arm, if you cut off a wrist, a hand, a foot, then you're probably going to need a tourniquet, but you need to get it on there, you need to cover it up, and you need to get the heck out of Dodge and get some help, because these are, there's time limits on anything that can be reattached, plus the fact that you can just flat out bleed to death if you don't get out and get help quick.
Psychologically speaking, cutting off a finger, I would be imagining enough, but you cut off a hand or an arm, you're going to want to panic at that point.
You will panic. I mean, there's no doubt about it. But the other thing is, you need to suck it up. I mean, you need to try to get under control. You've only got one hand to work with now. So if you're going to put a tourniquet in, it's going to require your mouth, it's going to require this, but you're going to have to do it.
The psychological advice from an ER nurse, suck it up. You're going to panic, you got to pick your hand up, you got to carry yourself out. Is it safe to say that if you give in to the panic, you're basically going to die?
Yeah, you're going to bleed to death, without being obvious about it. if you're out someplace that's isolated, or a place that's not isolated, it's in town, if somebody is hurt, you need to step in, see what you can do to help. If the only thing that you can do is call for help, then that's something that is absolutely good. Don't just say, well, they're probably okay, or they'll get over it, or maybe they're not hurt that bad, or no matter how squeamish you are and how things creep you out, you know, if you're out in the woods and you're alone and they're alone, you need to be the one to help, to start to step in.
If somebody's hurt and you leave them there because you're too scared to help, that person could die. That'd be on you.
A couple of things to help when you're out in the woods and there's nobody around you. If you have these little whistles, you can keep blowing it and still be doing things with your hands and maybe get some extra help.
And that sound is going to carry a lot farther than your own voice will yelling.
Yeah, this in no way is purely medical advice. This is just a few things to help you out, what you might come across when you're out in the woods. I mean, you need to have a first aid kit that has some things in it that are appropriate for the adventure that you're on. It's scary. I mean, it's scary when you run across somebody that's hurt and you're not medical, but you can tell if something's bleeding. You can fix that. You can help them if they've got a sprain or a strain or a broken arm, or there's things that you can do that are fairly easy, and a lot of it's common sense. Take a deep breath and move on.
Anything else?
No.
Nope,
that's it.
That was abrupt.
Mom's finished.
Well, Mama, thank you so much for being here today, and I really appreciate you kind of going through here, even though you threw some of my stuff. We will pick that up. I will pick that up. That was really helpful, and now I think at least I'm a little bit more prepared to be, dealing with my next accident in the woods, which hopefully doesn't happen, but likely will. So thank you for being here, and I truly appreciate it.
You know what? I enjoy doing this. I love my son, but this is not unusual for him to be running off to the woods. From the time he was very little, when I couldn't find him in the backyard with the gate that was locked, he was off somewhere in the woods. It took some hunting down sometimes to find him.
Thank you guys so much for joining us on this little adventure as we kind of went through the IFAK kit and the ouch pouch here. I hope you guys enjoyed this. If you did, please consider liking, subscribing, commenting. We read all of the comments. We love getting them. And until we meet again under the old Southern Pine, stay safe. God bless.